Good evening and welcome into another edition of One-on-One with Hubert Smith here on your community television of Knoxville on this Friday night, October the 25th, and we are live, L-I-V-E live. Now, if you've been watching this program for the past couple of weeks, you've noticed we haven't taken phone calls, and I hope that I have been diligent enough to explain why we were not taking phone calls, because we thought, and I still hope, that we were giving out some valuable information to you. Did we get the phone number up too, Mark? Okay. That we were giving out some valuable information. We are live. See, I'm talking to the producer. That I was giving out some valuable information to you that would help you in understanding, if you don't, and I know a lot of people don't, some do, great for you, help in understanding this Patient Protection and Affordable Care Act. And to my left, your right, is Dr. Mary Hedrick. She is board certified in internal medicine, a retired physician out of Union County, and probably one of the most knowledgeable people that I know about this Patient Protection and Affordable Care Act. So she has agreed to come back tonight live. And so tonight we want to take your calls, take your questions, take your comments, and see how far we can get in the time that we have remaining. Dr. Hedrick, welcome.
Thank you very much.
Glad to have you back.
Looking forward to it.
Thank you for the time that you have taken these past 2 weeks. Now this makes the third week, and doing a program about this very, very complex issue. And we've tried to, or at least you have, I haven't done anything, but at least you have tried, I think, to bring us along progressively over the past 2 weeks. And tonight we thought that we would take calls and questions, and the phone lines are open. So let's hear from you. 215-2288, 215-2288. If you have questions about, you see our background here, the Affordable Care Act, now's the time to call. So the phone lines are open. Let's see, we have a call already. Thank you for calling. You're on the air with Dr. Mary Hedrick. Go ahead, please.
Yes, I'd like to ask the question about the insurance for elderly people.
Insurance for elderly?
Yes, my dad has worked his whole life hard. The insurance that he got doesn't seem right what they're doing, and it seems like most of the insurances today are doing the elderly generations that built what the United States is today. When they get to a certain age, they're treated with disrespect. They're treated ungodly. Where I'm this 45-year-old, and the insurance I've got is like my dad's, but I don't have to pay no co-fees. I don't have to pay for my medicine. But my dad here, he's nearly 80-year-old, and he's had to pay co-fees. He's had to pay for his medicine, a certain good amount. Why is it that way? Are they just trying to kill off the elderly people?
Okay, hold on right there. Let's see if we get your response.
First of all, the question you're asking is about your father's Medicare and the combination of plans that he has for Medicare. Is that correct?
Right.
Okay. With Medicare, you have really 4 different plans that you might have, and so your father got Part A, and that's for his in-hospital part, and that has no premiums, but it does have a part you have to pay each time if you're admitted to the hospital. And then you have Part B for the outpatient, B like boy, and that he has a premium that he pays that comes out of his Social Security check, and that is actually a sliding scale premium that is adjusted according to his income tax filings. And then he will have co-pays for that, and then he may or may not have decided to enroll in Part D, as in dog. And that is for the prescription medicines, and there is a co-pay for that. And then the 4th kind of insurance that he may or may not have gotten, which may explain why he has extra expenses, is the supplemental insurance plan that will help with the co-pays and out-of-pocket expenses that your father is experiencing. Now, right now, we're in the open enrollment period for Medicare, so I'd encourage you to have him go to his senior services in Knox County or Department of Human Services and make sure that they go over the things with him and that he might be able to choose a better plan for him and his expenses.
Okay, sir, I apologize. We got to move quickly tonight. We've got a lot of ground to cover, short time to do it. I'll allow you a quick response if you have one. Did you understand in the end how she said?
I understand what she's saying.
Okay, thank you, sir. 215-2288, 215-2288. I don't mean to be rude, but I want to take as many calls as possible. There's a lot of information. No way we can cover it all, but we'll cover it as best we can. We're on here with Dr. Mary Hedrick. I would say she's an expert in the Affordable Care Act. She's practiced medicine for over 30 years in emergency rooms and clinics and et cetera. And so she is very well capable to talk about this issue. So until the phones start ringing again, Dr. Hedrick, why don't you take it and go with it?
Okay, first thing I would say is for the folks on Medicare, the changes shouldn't affect them.
Thank you for calling. You're on the air with Dr. Mary Hedrick. Go ahead, please.
Yeah, thanks for taking my call. Dr. Hedricks, would you explain the small business tax credits for small businesses that employ less than 25 employees? And I've researched that pretty good, and I'm a small business owner, and it looks like it's great benefits for small businesses. And before I hang up and hear your answer, you would have made a fine congressperson.
Well, hang on. We'll give you a chance to respond. Let's see if we can get you a response to your question.
Well, thank you. I have not read as much about the small business, the shop market, as probably you have. But what I do know about it is that for businesses under 50, as far as full-time employees, that they can go on the shop market for the premiums. And then those that have 25 or fewer employees whose average wage is $50,000 or less may apply for premium tax credits to help pay for part of that insurance for their employees. And it's my understanding that that premium tax credit is higher if the average wage is $25,000. So the lower wage, the higher the percent, and that it can go up to 35% of the premiums that you can experience. So is that pretty much what you found when you got on there?
What I read in 2014, the 25 or less, the 50 aggregate deal, it moves up to a 50% tax credit.
Okay.
So
well, you know, and it's an adjusted scale depending on the average wage for how much you get back. And I'm hoping that it'll be a good opportunity for the small businesses to go into that market.
Anything else?
That'll do it. Thank you,
Thank
sir.
you for your call. Appreciate it. 215-2288, 215-2288. Turn it back over to you, Dr. Hedrick.
I'm pleased that he had such a good experience. What I was saying is that for those on Medicare, the Affordable Care Act this year, the changes 2014 shouldn't affect them, so they can relax. They will see that donut hole for Part D close gradually until 2020 when it's closed completely. But other than that, there won't be big changes. However, we do want to give out a few numbers repeatedly while we're here. For folks who do not use the internet and don't ever email, I would encourage those in the Knox County area to call either Cherokee or the Knoxville Access Program and arrange an appointment to get individual help. So if you're not very proficient on the internet and you don't email, Cherokee is 1-866-672-1979. Again, 1-866-672-1979. And CAPA is the 865 area code 531-2766. So if you don't use the internet, I'd encourage you to set up an appointment with those individuals, and they can help you go through the entire application process and then help you, if you're eligible, to compare plans and proceed to enroll. And don't expect it to take just one visit.
So in other words, the big elephant in the room is the online thing is messed up. We know that, okay? But there are other alternatives, is
Yes.
what you're saying.
Yes.
Okay. There are other alternatives to going to healthcare.gov online. And would you please explain that again?
For the folks who are proficient on the internet, right now, in spite of the misbehavior of that website, you can go on and open an account and create your password. So if you do use the internet and use email, go ahead and sign up for an account. And at that location, you can then download an application and fill that out and either mail it in by snail mail or again call one of those 2 phone numbers and fill it out as best as you can and then sit down and talk to someone, because the whole application and enrollment process is actually 4 steps. The first is to create an account. The second is to fill out an application that's sort of like when you apply for a credit card. And then the third is when you find out what you're eligible for, to go ahead and, if it's for the marketplace plans, to compare those and choose which one you wish. You're going to have a choice of 67 plans here in our area. And then once you've made your choice, the 4th step is to enroll and mail your premium check. And you want to complete that 4th step by December the 15th if you want to get your enrollment and then actually be covered beginning January 1 of 2014. And so you can go to healthcare.gov and accomplish all or part of the application and enrollment process, and you just sort of have to see how good your luck is. But the part for getting on and creating an account does work for those of you who are comfortable doing emailing and internet things.
Here's a question I have that was asked of me. What if you haven't paid your taxes?
If you have never filed an income tax, it doesn't matter with respect to enrollment, but you will have to prove your income in some way. And so one of the documents that you want to take with you is your pay stub that shows how much you're making, and if you have a lot of interest income or some other source like a land contract sale of an old house or something, you'd take the proof of your income. So if you haven't filed income taxes in the past, it's good for you to take proof of your current income, and we hope that that is at or above the poverty line, because as you know, when you do that calculation, if you're at the poverty line, then you probably won't be able to afford the marketplace insurance, because we have not expanded TennCare in Tennessee. So childless adults may not be covered if they're quite poor.
Well, until we get another call, would you continue that line of thinking or that rationale or go down that line about what you just said and what the governor has not done and all that kind of thing?
Well, first let me explain what the poverty line is. You only need to know 2 numbers. First of all, you need to know $11,490. That's the poverty line for a household of 1, a single person with no one else living with them. So if you're a single person and you make beneath $11,490, then you probably won't be eligible for any program if you're a single adult. There are a few exceptions. Those folks who are on Social Security disability and meet certain criteria and are beneath 75% of that value, 3/4 of it, or about $7,600 a year, those folks could qualify for TennCare, traditional TennCare. But childless adults in general who are not disabled are not going to be able to apply for TennCare, because traditional TennCare is set up, and in Tennessee it covers children and pregnant women under 185% of poverty. That's 1.85, that poverty line. And then it covers 126% poverty line for some parents of dependent children, and then it covers some disabled adults. But to revert back, I told you there was a second number that you needed to know to calculate the poverty line, and that is $4,020, 4020. That's how much you add for each additional person in your household. So if you have a dad, the $11,490 plus mom and 2 children, you would add $4,020 3 times, and you would get $23,550. That's the poverty line for a family of 4. And the reason that that is important is because if you know where the poverty line is and compare it to your income, those individuals who are 1 to 4 times the poverty line, 100% to 400% for their household, those folks may be eligible for premium tax credits to help them pay for their insurance. And if they're 100 to 250% of the poverty line, or 1 to 2.5 times that, they may be eligible also to reduce their out-of-pocket costs, those things that our first caller spoke about for his father, who had a lot of out-of-pocket costs. So knowing your relationship to the poverty line is quite important, but you don't have to do it yourself. You don't have to get out your calculator, although I did bring mine. You can go online and it'll be calculated for you.
Thank you for calling. You're on the air with Dr. Mary Hedrick. Go ahead, please.
Yeah, I'd just like to thank y'all for having this program. I've really enjoyed it, and I've been able to get through. However, I've not been able to see my plans, but I found out what my cost would be.
Excellent.
Now,
on
did you
other websites, and I just want to thank you.
did you watch the previous 2 shows?
No, sir. My wife just come in here and told me about it, and
Okay.
Then
I just started watching it. It's good information.
We'll offer you a chance to ask a question if you'd like, if you have a question, or if you just want to leave us with that comment.
I'll just leave you with that comment, and I hope y'all continue it.
Well, let me just tell you, we've done 2 shows, and I'm going to come to you just a second. We've done 2 shows on the previous 2 successive Fridays, which were taped because she took us to school, more or less.
Right.
So we thought we would come tonight and open up the phone lines to get the questions to come from wherever they may, in whatever direction. So I don't know if CTV will put this up or not as a public service. I'll ask about that, but thank you for your comment. And Dr. Hedrick has some information she wants to give you.
I'm going to ask you to get a pencil and paper, and I'm going to say it twice because there is a place that you can go online and see what plans you're eligible for. And that is called Value Penguin, their site. So it's www.valuepenguin, VALUEPENGUIN.com, and then the /PPACA/exchanges/TN. Again, that's valuepenguin.com /PPACA/exchanges/TN. And if you go there, you just fill in your estimated income, household size, and it will list all the silver plans and how much they cost, and give you a place to click that you can go and look at the individual plans. So I'd encourage you, since you're so far along in your 3-step process, to start looking at those plans. We hope to have some copies of that at the local libraries. And Burlington, I know, Burlington Library on Magnolia has some of that information.
That sounds good. I appreciate it.
Thank you, sir. Appreciate your call and good luck.
Thank you.
Bye. Bye.
215-2288. You're just a fountain of information.
I'm learning every time I meet folks and they ask a question or someone else offers an answer. So we're learning together.
Well, let me ask you a question off topic. Now, we have about 8 minutes remaining, so please, if you have any questions about the Patient Protection and Affordable Care Act, please call in. We have a foremost authority on this topic, and we'll try our best to answer your questions. If she doesn't know, she certainly can guide you to where you need to go to get your answer. How did you get interested in this, for this Black for Better question?
Back in the early 1980s, when I got out of med school and started caring for patients, I witnessed what I thought was cherry picking and mistreatment by some of the health insurance companies. One man had a heart valve surgery, and he had had his surgery pre-approved by his insurance. And while he was in recovery in the hospital, his insurance representative came and said they had changed their mind and decided that he had a pre-existing illness. And then I had other folks who just couldn't get insurance because of a chronic medical condition, and others who were able to get the insurance, but it was incredibly expensive and took a real lion's share of the family income. And then quite a few folks who had lost their homes and declared bankruptcy because of illness. So I think our society can function better for caring for medical needs of folks and keeping them healthy and working and treat them better.
Well, thank you. Appreciate that. And let me just say, just for the record, on behalf of myself as a host of this program, I'm not advocating this nor criticizing it or whatever. I'm doing this, and Dr. Hedrick accepted because I thought this was something that could help some people, if for no other reason than to give you information. So do with it what you will. Neither I nor CTV are promoting or advocating the Affordable Care Act, but Dr. Hedrick is.
Yes, yes. As I jokingly said, I'm advocating for the Affordable Care Act and hope that it's successful and that many uninsured folks do get insurance. However, my favorite is single payer.
Thank you for calling. You're on the air with Dr. Mary Hedrick. Go ahead, please.
Yeah, I was wondering if you're only taking insurance out on one person in the family, do you still count both incomes?
Yes, you do. However, you file your income taxes. So if, for example, the husband is receiving Medicare because he's older and the wife is not 65 yet, they still have to look at the whole family income to calculate those percentages. Does that answer your question?
That answer your question, sir?
Yeah.
Did you hear the answer?
Yeah.
Okay, did you have another question?
Yeah, I'm answering it.
Okay. Thank you very much.
Yeah.
215-2288, 215-2288. Great questions.
They are.
You know, I noticed that we have an older audience
Two
tonight.
success stories.
But in order for this to be successful, my understanding is it must take in the younger audience.
Yes.
Who will pay for it but not necessarily need it. That sounds cruel, but that's the fact, right?
Well, I think
Or is that wrong?
No, that's correct. But I
Okay.
think what we're dealing with is the procrastination with the younger folks. They know that December 15th is the deadline, March 31st is the deadline if they don't care if they go bare for 3 months. So I think they're just taking their sweet time.
But then I think there's also a reality too, Dr. Hedrick, is that a lot of the young individuals that the president and others are counting on for this, and people like yourself, to support this financially, those young people have never picked up a telephone, never mailed a letter, or never written anything in long form. So the internet is all that they know.
Yeah. So
You
that healthcare.gov site being spruced up and made to work properly is going to be important for them.
To get the ones that you
Yeah.
want to get in, who will pay their premiums but not necessarily use them, online is all they know.
Well, let's tell some of those young folks, though, what's available. First of all, if they are under 30, can apply for a catastrophic plan where their cost will be less. It gives them 3 visits to the doctor and, a deductible, but those catastrophic plans are lower premiums. So that is an option for those under 30. Also, folks can be insured on their parents' health care plan up until age 26. And the other thing to tell them is that the penalties are low in 2014, but they will increase over 3 years and eventually reach the point where they'll be equivalent to what we call the bronze plan. There are 4 or 5, if you count the catastrophic, types of healthcare plans: bronze, silver, gold, and platinum. And help paying for it is based on what the silver plans cost, but you can still get a bronze plan or gold plan or platinum plan, and the young folks under 30 can also get a catastrophic plan. But as the president very aptly said, your health insurance is going to cost less than your cell phone bill.
Now, what about this thing that I'm hearing, reading, been reported, that insurance companies are just canceling policies right and left? Is that occurring actually?
That's not what I actually am experiencing out in the society that I deal with. What I'm finding is that insurance companies are pushing people to renew before the January 1 deadline to try to get them on existing policies and keep that business. So I'm seeing a bit more of that. And also we do see some folks, for example, some of the large companies have decided to offer employee-only insurance because they've concluded that it will be less expensive if the rest of the family gets insurance on the marketplace, less expensive for both the employer, the businessman, and less expensive for the family. So those cancellations of family plans are happening in some large businesses.
Okay. We have about 2 minutes remaining, so until we get another phone call, should we get another one, would you mind just going back and
Sure.
giving out that information again
Sure.
that may help someone out there tonight?
Okay, I would encourage you, if you're not comfortable using the internet, to call for an appointment. Cherokee 1-866-672-1979.
And that's Cherokee Health,
Yes,
right?
Cherokee Health.
Cherokee Health, okay.
And then Kappa is your other option in Knoxville area, 865-531-2766, 531-2766. And if you do like the internet and want to just see what plans are out there, a new website that I've enjoyed getting on is www.valuepenguin.com/PPACA for the Patient Protection Affordable Care Act /exchanges/TN. So that's a terrific website, valuepenguin.com, and you can feed in your income, household size, and see what the plans are in our area.
Well, I'm going to tell you what I'm going to ask of you here on the air, and we can talk about it. Perhaps maybe once a month or something, maybe you can come back on and just take calls and questions or whatever as we get deeper into this thing, as they get the website up and running and whatever, and we're able to be more functional. You might consider that. We can talk about that,
Yeah,
but
we'll see how
you know,
things go.
as things progress. Thank you so much, and in the 30 seconds we have remaining, I'll give it to you to say whatever you'd like to say to our audience out there.
Well, I hope folks will really go after acquiring insurance and be patient. Remember, you just have to get that premium check in by December 15th for enrollment to get coverage January 1. So stay in there and ask the appropriate people if you're experiencing difficulty or confusion.
Now, next Friday is First Friday, so we'll be off that night, but we'll be back in 2 weeks. I don't know what, but we'll be back with something. Take care, everybody. Thank you, and good night.
Thank you.
We didn't get our picture. Do you want to wait on him?
Whatever you want.
We didn't get our picture. You got time to take it?
Yeah.
Why, we got a screenshot?
Yeah.
Okay.
So does he take it through the...
No, it's on camera.
Ah.